So let's talk about your knees, your hips, and the 1.5 million people around the country are going to have a joint replacement procedure this year. Many of those people are in their mid-60s on average. I was kind of surprised to find that women outnumber men when it comes to joint replacement. Two most common procedures are hip and knee. 55% of all procedures allegedly are knee replaces. And now some of the technology that powers your smartphone could be winding up in your knee implant, giving you a smart knee. And that's our focus for the part of the half hour today. We're spending some time at the leading edge of medicine and a focus on this implant developed by Zimmer-Biomet, which of course headquartered in Warsaw over there, not far from us. And that all brings us to Dr. Jeffrey Yergler from South Bend Orthopedics. He's here in the studio with me. Good morning.
Morning.
Glad to have you here. He's a board-certified orthopedic surgeon. He specializes in knee and hip replacement and reconstruction. On the phone is Chase Ideleman. He is the Global Vice President of Enabling Technologies at Zimmer-Biomet. Good morning, Chase.
Good morning, Lee.
Broad experience he has in the medical device industry, surgical robotics, and a lot more. So we have a lot to cover here in this half hour. I want to start a little bit past the beginning, though, Doctor. If I've been living with knee pain for a while and the doctor says, yeah, you got to be thinking about this, how do I decide when to pull the trigger and move forward with an implant?
Yeah, when patients have knee arthritis, we obviously try to treat them non-operatively first. There's cortisone injections work well. There's different anti-inflammatories and things you can take, physical therapy. Really, once you get to the point where you can't do the things in your life that you want to do anymore, even with the conservative managements, that's when it's time to think about a knee replacement. The knee replacements used to be limited by the fact that they wore out fairly quickly, but over the last 20 years, the implants have become really good with regard to wear. So it's allowed us to do knee and hip replacements, especially in a younger patient population than we used to.
So I understand that people often make a significant mistake, and that is trying to gut it out and wait too long. How does that make the process worse?
Yeah, if they get too much of a contracture, too much of a deformity, it makes the recovery more difficult. It can potentially make the surgery more difficult. I still hear patients come in that say, well, this knee's only going to last for 5 or 10 years. Should I wait? And that's still kind of a throwback to the 1990s. Implants don't wear out very much anymore. Their bearings are really good. There's been tremendous improvement with that.
What is the best outcome? How much to normal life am I going to expect once I get through all this?
Well, with knee replacements specifically, the difficult thing is they get stiff and sore afterwards. Most of that goes away in the first 6 weeks with therapy. The only thing you don't want to do with an implant is run or jump on them. They're not really designed for high impact activities, although I have patients that do that and usually can get away with it, but that's not really what they're designed for. Sometimes kneeling is difficult, but other than that, the goal is to get you back to your normal life.
And what has to happen within my body to adjust to this new thing that you've put into my knee?
Well, with knees, the hard thing is they like to scar. So if you move the knee right away, that's not an issue. The biggest problem that people tend to get into or can get into with a knee replacement is if they don't do therapy initially and the knee gets stiff.
Mm-hmm. And that's kind of where this new knee from Zimmer-Biomet comes in. It's called the Persona IQ. So let's jump out to Chase a bit on that. What is this smart knee designed to do, Chase?
Yeah, so if you think about a knee, one of our most popular knees is called the Persona knee. We've installed it and had it in over 1 million patients. On the end of that, we call it a tibial stem, and that stem is used for fixation. What Persona IQ is, this smart knee, is a stem that has sensors in it, things like an accelerometer, things like a gyroscope, a temperature sensor, a motherboard, a battery, and all of that inside of there allows it to communicate to the outside world, really with the intent of being able to visualize data differently, specifically what we call functional movement. So how well people are moving in that recovery stage. And that's what's so exciting about this smart implant.
So how does it affect you, doctor, and what's my benefit as a patient?
Yeah, Yeah, there's kind of short-term and long-term benefits for both the patient and the physician. For a physician, it allows you to see a lot of data that you were never able to see. In the short term, that mostly involves gait parameters, range of motion, step counts, things like that. It's really nice. And we have patients now that are out and they come back to clinic, and you can easily pull up their dashboard and see what they've done every day since their surgery. Instead of spending 2 minutes with the patient like surgeons like to do and saying, yeah, you look great, see you later, you actually are able to look at a screen and see exactly what they've done and see that they're doing or not doing what they should be.
So it is automatically kind of in the middle of the night it's captured data all day, and then it sends a little burst of data to a modem that you have at home, and then it gets uploaded to the servers, and then you have access to it. I understand. Is that correct?
Right. There's a modem that you put under your bed, and every night it samples for 5 seconds and collects the data of the day. We have access to that, and the patient has access to that as well, so they can look at their own data.
So this thing is in my body for 20, 30 years. How long is it going to be transmitting data?
That we'll know that in 20 or 30 years. I think
the
prediction is that we hope that it lasts 20 years or more.
So how does it help you as not only my experience, but then do a better job with other patients in the future? What is that data going to teach us?
Right now, this is an emerging technology, so we don't even really know what normal is. As the numbers come and we do these on more and more patients, we'll be able to kind of develop a green light, yellow light, red light system where when patients come in at any stage of their recovery, you can quickly look at their numbers and say, yeah, you're right where you should be, or, well, maybe you're kind of not doing as well as you should, or, man, you're really struggling. And just with actual numbers instead of talking to the patient briefly.
Well, that's a good point, because what might be normal for me or what might be progress for me might not be for someone else. Chase, what are you thinking about this? How is Zimmer looking at this and the data that you're going to collect? How is it going to help you design a different knee implant?
Yeah, so to contextualize this a little bit, Zimmer-Biomet has been in the business since 1927, so we'll call it 9 decades of this. And we had seen a lot of iterative advancements in terms of implant technology. But if you look at someone getting a total knee surgery, the satisfaction rate is still about 1 in 5 generally are not fully satisfied with their experience. And that number has been generationally true. And it's something that if you were ever to go to an orthopedic conference, you'll hear that talked about all the time. What's exciting about this is it's the first time we are going to start to get an objective window into the episode of care and understand what's happening within that recovery process. Right now, the best way that we can look at things like quality is a potential survey that goes to a patient and they say, hey, are you satisfied? How's your pain, etc. But by being able to look at this in a compliant fashion over what Dr. Yergler said, 10 to 20 years, we're going to unpack a lot of information we don't even know yet. How are those patients doing at 2 weeks, 4 weeks, 6 months, 1 year? And is there a change? Are they on track or are they off track? Does the care team need to intervene or not? What we're running at here is just trying to solve orthopedic problems. And we need good data. We have to be able to organize it in a meaningful way, give it back to the Dr. Yerglers so they can make more informed insights.
Got it. So the device itself goes into the shin bone, into the tibia, right? So that's the little stem of the implant. Is everything else on top of that, the actual motion portions of the knee, is it the same design?
Yeah, it doesn't change the design of the implant per se. All it does is add a stem extension. I use stem extensions on almost all my knee replacements anyway because it helps the implant bond and potentially last longer. So functionally, it doesn't change the actual functioning of the implant.
And let's talk about what this is going to cost me. New technology always sounds like that's expensive. Is it going to change the cost of my procedure in any way?
Yeah, the way that it works in medicine with insurances and Medicare is that the cost of the implant is paid for by the facility. So the patients never pay for the implants per se. So there will not be any added cost to the patient for this technology.
And is Medicare going to cover this? Is this an option for me if I have Medicare coverage?
Yeah, Medicare covers total joints at most inpatient facilities. They don't really get involved with the cost of the implants. That's usually done by the facility itself.
So the facility negotiates the cost of the product, and then that's just part of the package when I go have my knee implant.
Right. If you're a Medicare patient and you have an inpatient procedure, Medicare will reimburse that facility a certain amount and not really care what the implants or the other costs are.
So why wouldn't I do this? Is there a downside here that I'm not seeing?
From my standpoint, no. There are a lot of suspicions in the brief time we've been using these. We've got a lot of interesting questions. There's not a GPS tracker in there. It's not going to tell where you are. You're not going to set off alarms when you leave a grocery store. Your battery's not going to explode on an airplane. You can still get an MRI scanner. It's not going to mess up your pacemaker. It's not going to give you radiation and cause cancer. Those are all the things that we get asked.
Okay, I get it. People with legitimate concerns. Let's get past those. We are talking today about knee implants here with Dr. Jeffrey Yergler from South Bend Orthopedics, and on the phone with us is Chase Ideleman. He is a Vice President of Enabling Technologies at Zimmer-Biomet. Before we jump anywhere else, Chase, give me an explanation of what that means. What is Enabling Technologies?
It's a good question. So if you were to think about Zimmer-Biomet as kind of a leading musculoskeletal company, we have a side of that that's completely dedicated to the advancement of implants. But where we're seeing this evolution around enabling technologies is specific to tech and data. And tech and data for us means things like robotics. And we have a robotic system called ROSA that's focused on things like accuracy and precision. Something else that directly connects to Persona IQ is a care management system called My Mobility with Apple Watch. It provides patients before and after surgery things like digital education so they feel engaged with their care team, messaging, self-directed video exercises to help them along that continuum. And it connects to platforms such as Persona IQ to positively impact their experience. So our vision for enabling technologies is really to have this integration of solutions that touches both hardware and software, again, with the intent of solving these orthopedic problems.
Got it. So you want to grow beyond being just a medical device manufacturer to expand what that means and the role that plays in my life. Got it.
Exactly.
Okay, hey, some text questions have come in. Do I need a referral to see an orthopedic doc? I think the answer is no, but fill me in on that.
No, you can usually go. You don't need a referral anymore.
Yeah, it's interesting anymore. Things have changed a lot around that ortho side of things, including the thought of when do I need to have a consultation or a process. Somebody's asking if my knees are only occasionally achy and hips are only occasionally achy. Is that something I should take to an orthopedics guy?
Yeah, I would. I think if you have a knee problem, you should see a knee doctor. Just like if you have a heart problem, you probably don't want to see me about it. So if you have knee or hip problems, I think seeing a knee or hip surgeon would be a good start.
If you have a question for Dr. Yergler, you can jump on the phone at 447-1190, 800-333-1190, or of course, as I said, you can text 46862. You just mentioned something I thought was pretty interesting, and that is COVID, and telemedicine has been great. We've all kind of jumped on board, but didn't really kind of seal the deal for you. There were a lot of things you couldn't do. Tell me about that.
Well, most of the time when you see an orthopedist, besides imaging, the examination is the most important thing to determine whether someone actually is having a problem or has a problem. Telemedicine and orthopedics is difficult in that regard. We have developed some protocols where you can set up the phone on your camera or FaceTime, and you can turn sideways and move your knee, and we can kind of guess what your motion is and those kind of things, and maybe watch how you walk. But I think telemedicine is going to become more important in the future. A lot of things have changed because of COVID, and we're more comfortable with things like telemedicine. What this smart implant actually gives you the ability to do is look at the data remotely. So it does track range of motion, it does track step count, it tracks a lot of things. So if you were doing a telemedicine visit even years down the road, you would actually be able to have real data to look at instead of just guessing.
Mm-hmm. I can see how that would be a big deal. What goes wrong with an implant? Why would I ever need to have that thing replaced?
Well, Well, so traditionally the big problem with implants was wear, but that problem has essentially been solved. There's early problems that can happen with an implant. The thing that we are most worried about is infection. When infections happen in joint replacements, they're difficult to treat because you have a foreign body in the joint and it's hard to get rid of. So every surgeon is very careful about preventing that. The actual infection rate nationally for joint replacements is low. It's probably somewhere around 3%. Stiffness is the other thing we worry about in the short term. In the long term, it's mostly things like debonding and stability problems, which are also low. The survivorship, the long-term survivorship of joint replacements in the United States is over 95%.
So debonding, that's the cement coming loose, or the implant itself getting loose in the bone?
Yeah, so traditionally most implants for knees were cemented. There is some increase in uncemented implants with certain companies that have become in vogue, but I would say that most implants, knee implants, are still cemented. And what we see, especially in our patient population, is the potential for debonding, especially of the tibial implant. Adding a stem to the tibial implant gets rid of that problem, essentially. I've never seen a stemmed tibial implant loosen, which is also an advantage of this stem.
Oh, that makes sense. Dr. Google has got to drive you crazy. You get nerds like me who come in and say, "No, I was looking at this knee from this manufacturer and this knee from this manufacturer, Chevy, Porsche, Volkswagen, however you want to compare those. What do I have a choice at all?"
Yeah, you're right. I would say that most of the implants that are made in this country are good. Every surgeon is going to have a preference as to which they think is the best. Getting information off the internet is great, but it can be biased. I would lead people, if they have general questions about joint replacements, to go to a non-biased source like the Academy of Orthopedic Surgeons, AAOS, or we like letters, the American Academy of Hip and Knee Surgeons, AAHKS. Those are great sources. Just know that anytime you're on a website from industry, they're obviously trying to sell things. And unfortunately, it can be like that with physician groups too, because they're trying to attract patients. So if you're on a website and it says that one approach is better than the other, or I'm better than he is, then just take it for what it is. It's an advertisement, and try to go to unbiased sources.
Make me smarter about this process. What are the questions I need to ask before I select a physician?
Well, I think it's just like anything else. I think probably the biggest question that patients ask that is a good question is, how many of these do you do? And I would expand that to how many of these are done at your facility. It's kind of like with your car. If you need new brakes, you're going to go to the place where they change brakes all day long because it's less likely that something's going to go wrong.
And you said about 1,000 knees a year?
Knees and hips, yeah, about 1,000. Which I'm a higher volume surgeon. There's a lot of joint replacement surgeons in this country that are great, and you don't have to have that kind of a volume to be a great joint replacement surgeon. It's just what I specialize in.
Hey, Chase, I want to ask you about the future of where this is all going. If you've put a smart knee in me, what's next? What else is Zimmer working on?
Yeah, it's a great question, and we think about this one all the time. Right now, if you think about, we think about disruption, if you visualize a bell curve as an example. Right now, robotics, quite frankly, it's reaching more of a mature state. Smart implants, this is the first ever it's been done, so we're early on. But if you look outside of healthcare, all of the signals in the market point to things like artificial intelligence, predictive analytics. So as we learn more about this information down the road, we're going to start to become suggestive in nature. We'll be able to risk stratify patients earlier on within the episode and understand who's appropriate for what kind of surgery and when, and then ultimately what a good recovery process may or may not look like. So understanding this information is going to be key in terms of the long-term goal of solving some of this.
Oh, that's interesting. So tell me, Doc, about what you think is the number one cause of people having the increase in knee replacement frequency that we've seen?
The aging population in this country, all the baby boomers. This has been coming for a long time. When I did my residency training from 2000 to 2005, and even back then, we were predicting just an exponential increase in the number of joint replacements that would need to be done year over year.
What role does our weight problem play in knee wear?
A lot. The knee is the most sensitive joint in the body to weight for whatever reason. And so that's why we've seen an increase in the percentage of knee replacements over hip replacements.
Man, I just got to look at the clock. I was engaged in our conversation, and our time is gone. We got to wrap it up. That is Dr. Jeffrey Yergler from South Bend Orthopedics, and on the phone with us was Chase Ideleman from Zimmer-Biomet. We hope that you enjoyed the program. We will see you next Saturday morning at 9 a.m.